Hello everyone. So today I'm going to present an article on effectiveness of percutaneous neuromuscular electrical stimulation for neck pain relief in patient with the cervical spondylosis, and we can say the CS. So I discussed this article with my colleagues and they found very interesting, so that's why I choose this article. So let's understand what is CS. Cervical spondylosis is a very common age-related chronic disease degeneration condition, and it often involves unspecific degenerative changes of the muscle, tendon, joint, bones of the neck and shoulder. There are many etiological factors that can lead to this condition, including the poor posture, anxiety, depression, neck strain, and the sporting activity. It mainly manifested with the neck pain, sometimes neck stiffness, and sometimes accompanied by the numbness and the radicular pain in the shoulder, arm, and finger. So let's jump on the aim of this study. So the study aimed to evaluate the effectiveness and the safety of the percutaneous neuromuscular electrical stimulation, that is a PNMES, for treating the neck pain in the patient with cervical spondylosis. So for this study, they choose 124 patients with neck pain of this years were included, and then they were randomly divided into two groups. First is PNMES group and another is control group, and the ratio were 1:1. All patients received the PNMES or the sham PNMES for 30 minutes daily, 3 times a weekly for 12 weeks. And the primary outcome was assessed by the visual analog scale, that is VAS, and the secondary outcome were evaluated by the cervical range of motion. And another thing they measure, that is a neck disability index, that is NDI score, as well as the adverse event, that is AES. All outcome measures were at the end of 12-week treatment and 4-week follow-up after treatment. And for this article, they excluded some history of the neck pain, trauma, cervical fracture or the surgery, congenital spinal abnormality, spinal tumor, cancer, and other systemic disease of the neck, including bone and the joint condition. And after end of the 12-week treatment and the 4-week follow-up, the patient receiving a PNMES exhibited more decrease in the mean VAS and NDI respectively, compared with the patient receiving the sham PNMES. Additionally, the increase in the mean range of motion was also significantly higher in the PNMES group than that in the sham PNMES group at the end of 12-week treatment and the 4-week follow-up, respectively. And no AES were found in either group. And finally, they conclude the result of this study demonstrate that PNMES is more effective than the sham PNMES for the neck pain relief in the patient with the cervical spondylosis. And lastly, some limitation for this article is like it is only one center, and which may impact the generalization of our result to other hospital. And second, this study failed to assess the comprehensive outcomes such as quality of life of patient in both groups. So all in all, the percutaneous neuromuscular electrical stimulation help in decrease of pain in cervical spondylosis patient. So it can help the patient to reduce pain.